Assalamualaikum, my name is Zainab and today my topic of discussion is IV medicines used in the GA. So let's start with the course outlines in which we will get through the introduction to GA, uses and duration of time of each medicine, mechanism of action, dose and onset of actions and route of administrations. Okay, so another slide in which I have specified the medicines which we will get through in this lecture: propofol, barbiturates, benzodiazepines, etomidate and ketamine. Okay. So first is the introduction to general anesthesia. What is the general anesthesia? General anesthesia is a medically induced reversible state of unconsciousness in which patient has lost their sensations, motor response and reflexes totally depend on the medicines and machine which is called anesthesia machine. And to introduce the IV medicines for general anesthesia or to introduce the medicines for general anesthesia, there are two routes we can choose. First is the inhalational agents and other is the IV agents. Inhalational agents in which sevoflurane and isoflurane can be used, and in IV agents there are propofol, ketamine and some other products, some other drugs which I will discuss in this lecture. So what is the purpose of general anesthesia? Why we need to introduce the general anesthesia? So its basic aim to facilitate the surgery and other medical procedures by eliminating pain and awareness. For elimination of the pain and awareness and facilitate the surgeon to do surgery without any disruption. Okay, so there is some overview of IV agents. Types of IV agents we can use are barbiturates, benzodiazepines, etomidate, ketamine, and propofol. There will be common uses are two which we can use, and for what purpose we have to use these medicines are for induction of anesthesia, for short procedure, for sedation and maintenance of anesthesia in some cases. So first medicine which now we will go through is the barbiturates. Tantana, there is thiopental, which is also known as. Their mechanism of action reacts on the GABA receptors present in the brain, which leads to increase the chloride influx, which results in hyperpolarization and CNS depression. So this working principle is same as for other medicines which we will discuss in next slides, except ketamine. Their doses vary. For example, their doses for induction is 3 to 5 mg per kg through IV, and it takes 30 to 60 seconds to start their action, and the duration lasts for 5 to 10 minutes. Their use is for induction of anesthesia and short procedures. So if we are using some medicine, there will be side effects too. So their side effects leads to hypotension and respiratory depression. Route of administration, as I had already discussed, it's the IV route. Another one, another one is benzodiazepine, which is also known as a midazolam, which can be anxiety reducing medicine also. So it acts on the GABA receptors as discussed before. So leads to increase the chlorides and it leads to CNS depression. But their dose is vary. For sedation, their dose is little bit slow. 0.2, 0.02 to 0.03 mg per kg, and for induction purpose is a 0.1 to 0.3 mg per kg, and it take 2 to 3 minutes to start their action and last for 15 to 80 minutes depend on the dose. For preoperative sedation and conscious sedation for procedures we can use the midazolam, and for anxiety too because this is an anxiolytic medicine. Their side effects leads to respiratory depression and hypotension, and route of administration is the IV agent. So another one is etomidate. Okay, so their mechanism of action, as already discussed, for act on the GABA receptors and leads to CNS depression. Doses vary 0.2 to 0.6 mg per kg, and onset 30 to 60 seconds, lasts for 3 to 5 minutes, and for induction of anesthesia and patient presenting with serious problems, we can use this medicine because this medicine are for hemodynamically unstable patients. Okay. Their side effects leads to adrenal suppression and nausea and vomiting. Route of administration, as discussed, is IV agent. Okay. Discussed ketamine. Their mechanism of action is varying, but all other drugs have to some extent have same mechanism of action. So they act on the NMDA receptors and agonist and antagonist and produce a dissociative anesthetic state. Dose varying 1 to 2 mg per kg, and Onset requires 30 to 60 seconds and last part 5 to 10 minutes. Induction for induction of anesthesia, analgesia, and for short procedures, for example, for burn dressings. Okay. So their side effects, they leads to hallucination and increased intracranial pressure. Route of administrations include IV and IM. Intramuscularly, we can also use the ketamine. So another one is the propofol. Propofol potentiate the GABA receptors as we already discussed, but they block the sodium channels. They doesn't lead to chloride influx. They just block the sodium channels and results to CNS depression. We can use for induction and maintenance also. Induction for induction, their dose is varying. For example, 1.5 to 2.5 mg per kg through IV, and for maintenance 100 to 200 milligram per kg for IV infusion. Onset of action requires 30 to 40 seconds and lasts for 5 to 10 minutes. Indications, induction and maintenance of anesthesia and sedations in ICU settings. Okay, there are side effects for propofol is, this is wrong, there is a propofol. Propofol. So, their side effects are hypertension and respiratory depression, and route of administration is the IV. Let's discuss the conclusion, in which I have all the drugs and wrote there peculiar properties. For example, thiopental has fast onset but significant CVS effect. Midazolam, anxiety reducing and for sedation. Etomidate for hemodynamically unstable patients. Ketamine provide analgesia with minimally respiratory depression. And propofol is commonly used for its rapid onset and smoothest recovery. Okay, so thank you so much for your time, and stay connected with me for further lectures. You can comment in the comment section and subscribe to my channel also. Allah Hafiz.